Hello and welcome everyone to another informative session on health and running by MRR Mumbai Road Runners, our most favorite, caring, and loving running community. So, today we are going to have another great informative session. And just to let you know that our guest for today is Dr. Kumar Janardhanan, who needs no introduction. He is an athlete, he's a doctor, a researcher, and of course, he's a teacher too. He has many research articles to his name. He is currently posted as the head of department at SRM Medical College, Chennai. And it is our honor and pleasure on behalf of MRR to welcome him today on our session about lifestyle diseases and running. So I welcome all of you, my dear audience, for this session. I hope the session will be interactive, interesting, and not only that, we will be taking questions at the end of the session. So we are going to have Dr. Kumar right now on the screen, all the way from the US. Very warm welcome to you, sir, and thank you for your time. It is an honor and a pleasure, and thank you for joining us today at this platform.
Good evening, Manisha. Good evening, my friends in Mumbai. It's an honor and a privilege to be here to spend some time on spreading some information, vital information about health, lifestyle, and running, which has been there, which has the bug has bitten all of us. But at the same time, we should also know how much is too much and how to find out the sweet spot that every person is inquisitive. All of us know something about running, but now we know that we are also hearing certain unfortunate incidents that are happening amongst our surroundings. So I think that this session will clear the doubts and the myths, if so. And Manisha, whatever questions you asked, I think probably will be hinting in those directions, I believe. Thank you all who have joined, despite being a Sunday evening. And let's see what this whole session can provide all of us a new beginning of, or rather a relearning of things that we already know and how to implement in our running activities. Thank you, Manisha.
Absolutely, sir. So we have Kranti wishing you a very good evening. Kranti Salvi is also one of the admins of MRR. And hello, Kranti. Nice to have you online with us as our first viewer and audience. And sir, I would like to know from you, first of all, how is it that you got bitten by the running bug? Because that's how, it starts somewhere for all of us. Some of us are accidental runners. Some of us get into it by planning for the health benefits. So, how is it for you? And how has it been so far?
Ma'am, I would come into that option one that you have just mentioned. I'm an accidental runner. In fact, I had a very busy schedule, looking after, taking care of my patients, working late hours in the clinic, hospital, and that was a priority for me. Health was never a priority for me, even though I was a doctor, and I was putting a lot of weight, and I had a lot of travels abroad, and being a vegetarian, I had nothing else to eat outside except for bread, butter, and cheese, and all these things had put on what do you call added a lot of weights around my hips. So
Right.
and that made my wife grumble about my health condition. And in my family, my paternal side all were diabetics, and that is where I really had to do an introspection and see that am I actually practicing what I preach. So, and my wife dragged me for running because it was just another accidental that she started to run first, and I was trying to be I was chauffeuring her from our house to Anna University in Chennai, where she and her friends, another two ladies, it's only three lady gang, uh, who started to run in Chennai. At that time, we didn't have any kind of what do you call any running group, as any organized structured group, running group. So we three of us, along with that, there was another gentleman called Mr. Kannan Shankarampadi, who used to teach them the what do you call what is running, the what is the run economics, the kind of the basic things that he used to teach them, and we just jogged. It's just a kind of a jog, and since I was just taking them to the run place and doing nothing, my wife said that why don't you also come for a jog? And with lot of puffing, I could just run between two lampposts. And it was, yeah, as all of us who have into the running field know that it was, baby steps were difficult, but then there was a perseverance. Somehow or other in my mind, I thought that now I need to do something about my health as well. So I think I am greatly indebted to my wife, Dr. Radha. She's also a doctor by profession. That we both started our running career in 2011, and in fact, our first run, which with the bib and other things, were the 10K run in Bangalore, that the TCS 10K, and
Right.
that's how it started. And now the last 11 years has been so nice. Running has helped me in organizing things much better, keeping
Mm-hmm.
myself calm. Anger management and stress level has improved a lot. And
Yes.
there I'm in front of you, talking to you, still running wherever I go. Because the first thing that I keep in my suitcase when I go outside Chennai is the sneakers and my run gear first. Then only I look into other things that has to be filled up.
Yes. So it's been a beautiful journey for you so far. And
Absolutely.
of course, you have proved yourself to be a great husband as well. So you've been chauffeuring your wife, and in fact, what she did was a gift to the running community. Now we not only have a doctor, we have somebody who's an athlete himself and understands the pressures that athletes face. When they're in their work life or in their family life, and how they juggle the two, and actually how running gives you energy to deal with all the challenges of life. So,
Correct.
sir, lately there have been, as you know, a spate of incidents and a very unfortunate ones, and related to running somewhere. But I would not want to comment about the nature of those incidents, in the sense of some runners having passed away in Mumbai recently during a run. And so that is why we can sort of speculate that it's probably the athletic activity that caused them to go on the other side of or getting some kind of incident that damaged their health. Or what is your take on that? Does running have to do anything with all of this?
Ma'am, to start with, I think those who are listening to this program have been running for more than 2 decades, at least minimum to
Right.
say. A majority of the runners in Mumbai road runners, they're all, for example, my very close friend Satish Gujar, and these are the people whom you can take that he had come out of a bad lifestyle initially
Right.
and has
Yes.
become a absolute one of the amazing personalities that I can figure out. He comes number one in my list. Satish,
Right.
if you are hearing, hi, good evening. So, what I would say that if you look at this, running has actually helped people to come out of those uh, diseases, in fact, which has been there in our body, and it has never produced any kind of bad results that we are seeing of late. So, what
Mm-hmm.
has happened now is that the running community has, they blossomed, and
Mm-hmm.
in a very fast pace in the last 1 decade.
Right,
And
sir.
we are all heterogeneous. We start running at different times in our life, what do you call, at different ages, and we have a lot of heterogeneous medical issues, either known or mostly unknown. and
Right.
and social media, Facebook, Insta, all these are adding some kind of peer pressure as well. And so everybody wants to talk about their timing, even though they don't want it, but they are. I would be very inquisitive to know what is my friend, for example, Vijay and I did in a marathon. So even though I'm just quoting because so I'll be looking at into all those numbers, and they'll look at the bib numbers and go to their event and find out what is the time. So unknowingly or knowingly, we all want to improve our timing. Fine,
Right.
timing is incidental. That particular aspect is not taken as because of the same peer pressure. So we ramp up mileage, and since we are all professional, we are not just a runner. We are recreational runner. Our professional work will take away the sleep time. Probably we come late from work, and next day morning we are forced to go early morning for a run. So the sleep is totally disturbed. So what I can see in the last what had happened 2 decades back and recently is that a is the disturbance in the quality of sleep. It's just not the number of hours you get to sleep at night. It's just that
Yes.
the quality of sleep is poor, and we ramp up the mileage. We want to do better and better and better in a very short span of time. Three,
Right.
we have also, sorry to say that we are also having uh, what you call mushrooming of a lot of coaches. And most of the
Absolutely.
new coaches that we see, they are all again have, they are all runners, yes, but they have got some certificate from distance. I mean, what you call the Zoom call of running, because they somehow want to utilize their free time into coaching. So they also become self-certified coaches or elite coaches, and they put a lot of pressure. I'm not saying all, mind you. This is
It's
I
just a
may
general opinion that
generalize
you're
my
giving.
statement. There are
This is
few
your
coaches. What they do is
observation.
that they push on their mentees that you can do better and better and better, not knowing their limitations. So we do have issues from both sides, a runner's perspective as well as the coach perspective, who adds on ramps up the mileage without knowing their what is their limitation. First of all, each the runner himself or herself and the coach or any other person or your friend run, but you should know what is your limitation. So
Yes.
all these things have happened, but the bottom line is that we had COVID in 2019. So it is all. I mean, if you can see, the number of events were hardly reported. Maybe once in a year we come to know that about something bad happened at home. A person collapsed or something unfortunate happened, or an elderly person beyond
Mm-hmm.
80 years or 70 years. It could be a
Right.
natural death, or he would be suffering some ailment. But 2019, we see 40 plus people, just 42, 45, 47, between 40s, in their 40s, they
Yes.
are succumbing all of a sudden. So
So it's
we
it's
have
mainly
to.
stress. So it would be wrong to blame running as such, but we
No,
have
I
to
don't
analyze
believe
the
it is
background
not running.
factors.
It is probably something that, post COVID we are seeing. COVID is something that really has created some kind of an issue, health issue, even for a fit person.
Right.
If you can look, lot of people who have gone to gym, they collapse in the gym.
Right, sir.
It's probably not. It's not running to do. So it's kind of, some kind of physical activity
Mm-hmm.
in a diseased heart, which was not diagnosed prior. So this
So
is
these
where,
are
what
ailments
we
that
the
you're
term we call it as sudden cardiac arrest.
right, sir. Right, right. So you are to put things in perspective about what you just said. Because we are very quick to blame or overdoing running. It's probably better to analyze your own body and take a call, an informed decision. And avoid the run if you feel fatigued or tired, and not succumb to peer pressure on the one hand, and at the same time choose a coach who is very who has a track record in
Correct.
running. That's what you're saying.
Yeah, correct.
Right.
Exactly. So
Right.
but the coach is something that, who must be your run buddy as well as your uh, a person who you know him well and he knows you well.
Right,
He's just
sir.
not a you look into Facebook, look at the run coach, and you just, there are certain apps as well where,
Mm-hmm.
the run bots, the artificial intelligence, they give you a run plan. It's not
Right.
even a physical guy. It's just an AI artificial. They just tell, this is your run plan. This is how you have to do it. So probably, you have the Hall Higdon method. These people don't know us at all.
Right.
I'm not just saying. I'm just quoting an example. There are a lot of
Yes.
people who are mentees of people who are elite runners abroad, who don't know anything about us at all. So we need to know our limitation and then stick on to that, because we have already termed ourselves as recreational runners. So this is a part of
Right.
recreation. We are not professional. We are not looking into podium finishes. We just go there, and I come to Mumbai just to visit my friends and have a beer post run.
Right. So
No,
that's
that is
that's
the
the
only
need.
objective, and the timings are all incidental. Uh,
Right.
and people, if they can accept me with my timings, I think then, and you are calling me for a show, then I mean, what I'm doing probably is the right thing.
Right, sir. So absolutely, what you've just you've hit the nail on the head by saying that we all need to be happier runners.
Correct.
Running should add value and not stress to our life, and so finding that fine balance, like you mentioned, the sweet spot is something where to recede from, and that will probably help us in our running journey. But also another thing that interested me when you sent me your bio and I was just going through it, is how much focus there is on diabetic medicine and how you've been like, you've published papers on it.
Mm.
And there's so much of knowledge behind that one lifestyle disease that you've actually explored. So how, and since 40 plus male population or female population may be more prone to that kind of a lifestyle disease, so what do you think is the ideal sort of running quota or any precautionary measures for diabetic runners? And since, because that is your expertise, and that is why I wanted to ask you about that.
Very good question, ma'am. I would say that in India is we are second to China when it comes to the prevalence of diabetes or the volume of patients who are suffering from diabetes. Unfortunately, 50% of the population don't know they are having sugars which are not normal range, not within the normal range. Only 50% know that they are diabetic because they would have gone to doctor for some other problem, maybe for some
Right,
other ailment. Incidentally,
right,
they would have found their sugars in the diabetic range, and they would have started medications and advice the doctor give on the food that you eat and other exercise. Okay, but the other population, I mean, the rest, we don't know that we are having diabetes because this runs in the family. So
right,
if you we have to look at least last three generations. Anybody in our family, parents, grandparents, uncle, aunt, anybody in the last three generations having diabetes. If we say I don't know, that doesn't mean that that doesn't exist. But if they all
right,
checked in, but I can tell you that probably we don't have any single member in Mumbai runners that there any of these three generations didn't have diabetes. All would have got diabetes, or they would not have known. So it is imperative that all of us, before we start our run journey or during our run journey, annually at least, should do the basic test: blood
right.
sugar, ECG, treadmill. And post COVID, lot of non-diabetic people are becoming diabetic because
I
the
see.
virus attacks the pancreas as well, and it
Okay.
produces disturbance in the insulin production. So we are seeing new onset of diabetes since 2019. Family history is absolutely good. They have all checked up. The person is lean, person is not having what a patient, I mean, person is not overweight, and he has a very good lifestyle. Whatever we talked about, the risk factors are not there at all.
Right.
Despite that, you can see the sugars going up, 250, 300.
Oh,
So
that's good. Yeah.
since COVID, I think we all have to keep checking our sugars at least once in 6 months to make sure that we don't fall into the wrong category very soon, and that then blame the running as the reason for the untoward incident.
Right. So do you think, like, you mentioned 6 months, but is that you're mentioning that for a certain age group, or is it, a blanket age group that you're saying that everyone generally, because COVID is something that we all may have had it knowingly or unknowingly, we may
Correct.
have become carriers of it. So do you think it makes us more prone in that sense, and so it's a good idea to get everyone checked, like, without considering the age group as a major factor for
Ma'am,
diabetics?
ma'am, everyone should be checked their sugars annually once. That's for
Right.
sure. And if you
Okay.
are if there is a number that is not coming into the within the normal range, and probably all may not require medicines as well. Because if you are going to cut down your carbs in your diet and you start exercising 150 minutes a week, this is what American Heart Association recommendations are. If you are going to do a moderate to vigorous exercise 150 minutes a week and cut down your carbs, probably you can be off medications or you don't require medications at all. So these are
Right.
the borderline, we call it diabetes, the sense that sugars are just around 5 points up the normal,
Right.
that capping the limits that we call it. So these people, running definitely helps. Or any kind of physical activity. Running is the physical activity we are all having. So we are in this group. But there are people who do some CrossFit exercise, people who cycle, people who swim. So everything adds on to it. So you can definitely look into these aspects. So what I suggest is that after 40 years, I think we should all check our sugars. If the sugars were abnormal range, at least once in 6 months, provided you are not being tagged as diabetic. Once
Right.
it's diabetic, then I think we should all we meet our family physician, and then take the advice forward from him. Even if you don't
Right.
have any family physicians, it's mandatory that you go for your annual health checkup. And
Right.
one annual checkup doesn't, when I say annual checkup, people do, I have in my friend circle, they said, I have done my checkup, it was 3 years back, it was 2 years back. So I think that the word annual has lost its meaning probably. It's
Right.
year on year. I think we need to keep and looking at the trend, the numbers. Are the numbers
Absolutely.
increasing or the numbers are showing a downtrend? Based on that, you can know that where our health is uh, directed.
Absolutely. So we had a question on the same lines by Narayan Ganeshan, and he had posted that, Doctor, when you get the time, please elaborate the importance of medical tests for runners. Since he has mentioned in brackets that we just run without doing the medical test, and I think you answered that question pretty elaborately. So my request to Narayan is that if there's any further query that you would like to post, then please do post it, since we are already on the topic of how the importance of medical screening amongst runners, especially since it's a demanding sport, and one that requires a lot of physical fitness to begin with, and improves it in the bargain. But of course, medical testing can bolster your health in that sense. So Narayan, if you would like to post any more questions, do let us know. So doctor, what other issues do you think that we should be aware of as runners? You mentioned something earlier called, when we spoke you just informally this morning, about the athlete's heart. So that's
Mhm.
another thing that you mentioned, and that really flummoxed me somewhere, because I also didn't know about this. So if you could just elaborate about that, and then also I will take the question further about your friend who had suffered a bad incident. But we'll come to that later. But do tell us about the athlete's heart.
Yes, ma'am. I think that is one important thing that we should all aware of. See, if any one of us, or rather most of us who have been running at least for 2 to 3 years and building up mileage, and we call it have a relatively good endurance. So means who are running a long, say like LSDs on Sundays, and you have been doing
Right.
it for 2 to 3 years. What happens is that for running, we require more blood supply to the entire body. It's just not the for the legs, for entire body, we need more blood supply. For receiving more blood supply, the heart starts enlarging a bit slowly. It's just it's not a normal heart. The heart starts enlarging slowly so that it can receive more blood during our when we keep pounding our legs on the asphalt. So the heart enlarges a bit. So there are some structural changes that happens, and that changes are normal. So
Right.
if you are going, and there are certain subtle ECG changes as well that occurs in an athlete. They are again, you should that when we go for our annual checkup, and the doctor finds something abnormal, that should not be an alarming sign as well, because this is an double-edged weapon. So a person who knows your history as a runner,
Mhm.
that becomes very
Mhm.
important. So you have
Right.
to tell the doctor or the sports cardiologist that I am a runner, I have been doing all these things. So they will factor in those things and then look into the heart and the ECG. Else they
Right.
will tell you that, oh, they'll scare you that you have an abnormal ECG changes, you have to go and angiogram and then blah blah blah. That will probably stop our running. Maybe
Right.
not, but our spouse will get so much afraid of it, so they will not allow us to get out of the uh, our house. So this all adds to the issue. So I think that we need to find out a team of doctors,
Mhm.
especially in MRR. We have a lot of doctors who are also in running,
Absolutely.
where
Right.
we need to check with them as well about the changes in the heart, in the echo, as well as in the ECG in a runner. Same time, we do have some certain ECG changes that can also tell you that we are prone for having a sudden cardiac arrest. That's why I said it's a double-edged weapon. So
Right.
it has to
Right.
be
Right.
very careful that we meet a sports physician or a sports cardiologist, not a general cardiologist,
Okay.
and recheck the changes that are there. That's where it is called athlete's heart. It's just a
Right.
readaptation of the heart to receive more blood, so that the heart itself will get more blood, as well as it can distribute blood to the entire body.
Right. So the body is an intelligent medicine. It's an intelligent organism by itself. It learns and grows and adapts, and so does
Yeah,
our heart. And
yeah.
which is why runners keep increasing their distance. And the point is to be gradual about it. Get yourself
Mhm.
checked every time, and not be taken in by certain hoaxes that come up in those, well, not hoaxes, but some misreadings, or if the doctor doesn't know our background as athletes, because somewhere we all, if I would call ourselves that, as athletes, because we do regular physical activity, we have a certain level of fitness, and we are passionate about what we do. So if a doctor knows about this, then he can certainly consider those factors. And we need not be scared about this thing called the athlete's heart, because as athletes, we have enlarged hearts. Is that what
Yeah.
you're saying?
Correct, correct.
Right. So, sir, we on that vein, there is a question from Parvesh Verma, and he's a member of Mumbai Road Runners as well. He has posted a question: if you can touch upon heart bypass surgery and rehabilitation. He had undergone it last month, as recent as that. So, if you could just help our runner Parvesh about his query.
Hi, Parvesh. Happy to know that you are back and attending this program means to say that how much you give importance for physical activity. It's unfortunate that you had a bypass surgery. That has nothing to do with running. That tells you that you probably had some clogged arteries in your heart, which prevented the blood flow to the heart, so you had to undergo a bypass surgery. Said that, I will tell you that to come out of it, bypass surgery, we still have to maintain a good lifestyle, because bypass surgery is just a temporary procedure that redirects blood through the new vessel. Mind you, this vessel is from your own body. That doesn't tell you that vessel is good. That is also having some amount of cholesterol in it, which is not a normal vessel. So we need to live with this problem for rest of our life. So lifestyle management continues. It's unending till our last breath. So we need to make sure that you go back to your walking, your running later on, probably not immediately, just a month. If you are too early, I think your physician will tell, your cardiologist tell you what is the heart function. So the heart function matters a lot. If you are having an heart function, we call it that ejection fraction. If you look into your echo, you can see the numbers in it, and the doctor will tell you if your heart is good despite your bypass surgery. I think you can start walking on a plain ground, not on an elevator, surface, on a plain ground, till you
Okay.
feel there is say 15 to 20 minutes every day. That's what you can do it, provided your blood pressure is under control, provided your sugars are under control. So you can definitely need not be indoors. Just because a bypass surgery is gone, people start going back to the shell. That is absolutely not required. I think we have you too can run. Pichmani Venkatraman, he himself has undergone bypass surgery, and now you can see that every Sunday he does an half marathon. So
Right.
this is not the end of life. Actually, this is the beginning of a new life where you can be an evangelist. In Even though we had an bad past, it can doesn't stop us from our physical activity. We can move forward, but we have to be very careful in taking the baby steps. We have to redo our things what we have been done prior, but it is going to take a long time. So
Right.
8 months would be my timeline where you start walking slowly. It all depends upon your heart function, and your cardiologist will definitely tell you when you go for your review that your function has improved. If he's giving you a good vibes about your heart function, probably then you can, that 15 minutes can become 20 minutes. Again, it's all walking. 20 can become 25, until you can walk at least for about an hour, 40 minutes to 1 hour time. From there onwards, then asking your cardiologist, you can start looking at walk jog pattern. So everything
Okay.
is going to take at least 1 year from now till you can go back to your running. But till then, take your medications, visit your doctors, and a doctor knows you much better than what I can tell. This is a generalized statement. Definitely, you can go back into your running mode maybe from a year's time, but slowly you start doing it so that the heart also starts adapting to the after the bypass surgery.
Right. So, Parvesh, I hope that answers your question. In fact, what the doctor has just said is very, obviously backed by an expert understanding, of the medical background that's required, for rehabilitation, and the steps that I mentioned. Of course, as Sir mentioned, is just an advisory, and guidelines directly can come from your own doctor. We wish you a very, very happy and a slow recovery probably is a good idea at that time. Slow meaning not sir has given you a timeline of about a year. So I wish you all the luck, and you'll be back on your seat, on your feet soon. Don't lose heart. Okay, and we'll see you running sometime soon in Mumbai. So about that, sir, thank you for that expert understanding that you have just presented. However, on the flip side, we have this question about your friend who sadly passed away, and how did that come about, and what is your understanding behind this incident,
Yeah,
because that will help us
incidentally,
to shed a lot of
yeah.
light on this issue.
See, when you talk about, I still have my goosebumps. When you talk about, I today is his birthday. If he was
Oh no.
with me now, we would
Right.
have been running, or we'd had maybe a virtual run today. I can see my, oh my, sorry. His
So my
name is
question
Karthik.
is,
We have been running for last say 5 to 6 years, and every Sunday, if I'm in town and if he's in town, we run together. There is. Because since I have my work pressure, I get only my Sundays free. So my group runs are, weekday runs are usually solo runs, and the weekend runs are group runs. And invariably, I run with Karthik. He is an gifted runner, and
right.
he said he was a diabetic, and he had a very bad lifestyle in his college days.
Okay.
I don't have to mention what. So he came out of it, and he is such a gifted runner. I think in Mumbai he had done I think he did, I think 4 hours of full marathon.
Oh
Four
wow.
points, yeah. So that's the kind of, when I say gifted runner. And on come Sunday, he will reduce his pace, and he's my pacer actually. So whatever the run plan I have on Sunday, I spell him out on Saturday night itself, and he adjusted my, so I don't have to look at my Garmin at all. So Sundays the Garmin is just a device to see at the end of the run whether I have done it properly. He will tell me, and exactly, he actually gave me the confidence that I can do a kind of a run, full marathon, below 5 hours. So I did my Delhi as well 2 years, on 2018. My first sub 5 full marathon. So even though I had a coach, again coach was in a kind of a remote coaching. So he was actually my coach. What happened is that one fine morning he just collapsed in his house and he passed away. He was in the
Oh.
pink of his age. Diabetes was under control. His sugars, his BP was under control. And he did about 3 weeks back, prior to his unfortunate passing away, his health checkup. Every numbers were, which he had done is normal. So that comes to mind that running probably, this should not be constituted as running actually has killed him. That is absolutely a myth, and that we need to get away from it. Running actually has helped him to live longer. Else he would have died much earlier. That's how we have to look at it. But then again, he was only 44, 43, I believe.
Right.
So a parent of one child, and look at his family. They're still in a shock. So we do a lot of help to them in the sense that moral support. They are well-to-do people. So moral support, we do talk to them, say hi to them. But then loss of a family member, is something that irreplaceable. So I would suggest that we need to know about our body. There are a lot of things that we don't know. We do this annual checkup based upon certain conventional surrogate markers. But there
Right.
are other risks that we need to ponder on. Probably one important thing for my runners who are listening to this is that in your family, if somebody had a premature cardiac issue or a stroke, when I say premature means less than 55 years, they had a stroke or they had a cardiac issue for which they had doctor has advised to do certain tests, including an angiogram, it becomes imperative that you do one test which is called cardiac MR. So
Okay.
this test has never been ordered in our as a part of package because it's not required. This is a bit costly test, but cardiac MR has come into is there available in all leading cardiac centers. So cardiac MR will pick up the small scars in our body or whether we have any kind of genetic issue. When I say this is again in family, high risk family, not for all. So
Right.
in a family who had an unfortunate, not death, prematurely they have some issue that had a heart attack less than 55 years, being a diabetic or non-diabetic. So cardiac MR, if we can do once, we can know what is it. Number two is an angiogram. We have now
Right.
non-invasive angiogram. As soon as my friend Karthik passed away, within 3 months I did my all these tests myself. Make sure that whether I do have any kind of that actually made my mind to think in those lines. So you have to do a cardiac non-invasive angiogram and look at your
Mm.
calcium deposits in the coronaries. So if you can
Right.
tell your doctor or go yourself, probably the doctors who don't realize all these things, they say, no, Baba, no need, you are young, you don't have to do it. But I would
Mhm.
rather suggest that you go ahead and do it if you are covered with insurance or not. Spending 10 to 12,000 is not a big issue at all. So if you do it
Right.
once, and probably you can repeat this after 3 years. So if the
Okay.
numbers are good, you don't have to worry. If the numbers are not good, you have to take some medications. That doesn't stop you from running. At least we know that, okay, we have something that is lingering in our system which is not picked up by our conventional lab test, because
Absolutely.
ECG and echo will not pick up all the issues. So cardiac MR and non-invasive angiogram are optional test. I'm not saying mandatory. Optional test if you want to make sure that you come from a high risk family. Make sure that
Okay.
that running should not what you call invite trouble, because any kind of physical activity should invite trouble because you are already having a damaged heart which was not diagnosed.
Right, right. So what is happening here is like the lack of diagnosis and
Hmm.
also the correct diagnosis
Correct.
is what you're saying, because there are certain diagnostic tests that can probably help us on that path that we want to take, and advise us is whether to take running as a sport or to opt for something else. um, and another question, sir, I have, and I'm very sorry, first of all, about your loss. And, I'm so sorry to bring that up during the course of the interview. But it is something that, if it can give some knowledge to our huge community of runners, and we have thousands of runners all across Mumbai, and everybody across India is probably watching the show because it's going live on FB and it's on YouTube. So it was only my intention to bring that up so that we can shed knowledge and some light upon these issues which boggle runners day in and day out. And also, the next question that I have, and I know Kranti has been waiting for a few minutes already, so I wanted to take that up, and it's a little different. We are going back to the diabetes issue. So she mentioned that since diabetes, people who suffer from it have a reduced carb intake. So how a diabetic runner manages nutrition, because he needs a lot of fueling in terms of carbs for a run. So how do you resolve that dilemma?
Hi Kranti, nice to connect you in this way. I mean, that's again a myth that need to be addressed. A diabetic runner has a problem of the insulin secretion. When I talk diabetic runner, we are talking about a type 2 diabetes. Um, he has a lot of insulin in his body, but that insulin is not functional.
Right.
So, and when you're talking about running, it all depends upon the level of your intensity. So, if you are going to do a speed interval, actually running will increase your sugars. It is not going to
Okay.
decrease it. So, when you're
Right.
doing speed intervals, you don't have to require any extra carb in your diet. Only when you are going to do an called something like aerobic running, long distance running for more than 1 hour,
Okay.
because then only we require a supplementation of carbohydrates. um, I mean, if you're going to plan your run, which is going to be more than 1 hour, otherwise you don't have to take anything at all to replenish, because we have enough carbohydrates stored in our body in the form of glycogen. So
Okay.
that glycogen will take care of all our nutritional needs if you are going to run within 1 hour. And if you are going to do speed intervals, actually your sugars are going to spike. It is not going to go down. Again, you don't have to take any kind of extra carb. See, we always feel that okay, आज कल रात को हमने खा लिया, today tomorrow हम दौड़ेंगे आधा घंटे ऊपर से. So that is something a wrong notion. So when we
Uh-huh.
eat, we also take in carb, we take fat. All these things don't tell you that okay, I have taken extra 1,000 calories. Tomorrow I will do an extra 10K, and
Absolutely.
I will try to balance it. That's a myth. So
Okay.
the fat stays in our body as fat itself. Only the calorie that you're burning out is probably a lot of carbs, but the fat is being stored in your body as glycogen. They don't stay as fat. They are stored in different
A
form.
sugar, basically.
Uh, and they
Right.
get stored in your liver. That's where the liver get damaged. It's just
Okay.
not the kind of lifestyle. If you can screen one test, which I want to add on, which doesn't come under our perspective of a talk, is the liver.
Mm-hmm.
The liver is the one
Right.
that tells you probably the first signal that your heart is going to get damaged later. That is called the
Okay.
fatty liver.
Right.
So if you can do an ultrasound during your annual checkup and look whether there is fat in the liver, they call it fatty liver.
Mm-hmm.
Whether you take what you call alcohol once in a while, or you are a teetotaler, if you feel that, if you see that doctor has your radiologist have said there is a fatty liver, that is
Mm-hmm.
your first signal saying that something is wrong in your system. You need not be a
Right.
diabetic.
Okay.
So that has something that we need to make sure there you have to cut down your carbs. So doctor, if you're going to an honorary physician, he'll say that no running, you have to check your sugars quite often, not required. If you're having
Uh,
insulin on board, there is when you have to be careful. If you're only on
right.
medications, uh,
Right.
simple medications, and you have a decent lifestyle, I think
Okay.
carbs day-to-day management is much easier, and you don't have to
Okay.
overfeed yourself, because we have this
Right.
so-called uh, carb feeding on your week prior to your run marathon. That's again is not required for Indian, because we are carb feeding every day.
Already heavy on carb.
365 days we are carb feeding. This is for
Right.
the people in West, where they're mostly it's a protein based diet, and they require
Absolutely.
more carb on your marathon week. So that's where
Okay.
the carb feeding comes in. All this pasta, they're all kind of it's a kind of we just imbibed it without knowing that we are already having a good carb in our diet.
Absolutely. So that's like across runners, across continent, we also have to understand our bodies are different according to the places or the countries we belong to.
Correct.
Because, of course, it's like you said, it's a process of adaptation. We are adapted to the Indian environment, and our diet has been traditionally carb based. So we need not consume that many carbs a week prior to a big
Yeah.
event that we've been aiming for. So Kranti, I hope that answers your question. And since this session is all about improving your health and being a conscious runner, okay, someone who takes care about of your all the factors. So there's another question that we have, and that is from Ram. And he asks, it's a little off topic, but I will take it anyway right now. It is, some runners do get headaches after running, and what could be the reason? So is it connected with sugar consumption? I think this is what Ram is trying to ask.
The cause of headache post run can be uh, more than 15 to 20 causes.
Oh, I see.
The common things come common because if a person is already suffering from migraine in his childhood, because sometimes running can trigger off, or any kind of physical activity can trigger off. But the most common we can be blame it on sodium.
Okay.
Either after the run we take too much of water and we can sodium level goes very down.
Okay.
That could be one thing. And
Okay.
especially if you are going to have headache after the run, if the sugar goes down. So many things are do play. So we need to check ourselves whether during the time of headache we have to draw blood. Have to see our electrolytes and our sugars, because when the sugar drops too low, when I say that
Hmm.
when the sugar drops below 70, we get
Right.
headache. One of the reasons for headache is low sugar post
Absolutely.
run. It may not occur immediately. I'm talking about 2 hours later or 3 hours later. So if you are not hydrating well during the run, especially I'm talking about long run or kind of a vigorous Tabata kind, vigorous hit, high intensity training,
Interval
if you are
training,
going
right?
to do, and if you are going to headache 2 hours later, I think these are the things that we need to keep checking, because no two
Absolutely.
people will have the same reason. So we need to figure out what is it, and uh, redo. I mean, make sure where we find the problem and solve the problem. So look at your electrolytes, look at your sugars, and look at your blood pressure. So,
Okay.
blood pressure at the time of your headache, and see whether it's a hemicranial, one half of the body, or it is that a throbbing headache. So, stress
Okay.
can also add on to it, because we do an workout, then we immediately go home, freshen up, then go to our place of work. So, and Mumbai traffic. So all these things, that's the stress that we call it. So we need to find out whether it's an stress headache, whether it's because non-running days, if you're not getting headache and this is the stress that adding on, probably that is called stress headache. So we need
Okay.
to figure out what exactly is the cause of headache. Because headache, I can give you a list of 20 odd reasons which can probably scare you off. So I don't want to talk much. So simple
Right.
things: blood pressure, check your electrolytes, and check your sugars. If these three things are taken care of, so if an increase in sodium is also can produce headache. So if you are not replenished with water or taking too much
Mhm.
of water post run, so that's
Okay.
where you have to take it. It's called isotonic fluid during your run.
Yes. Right.
There are a lot
Right.
of things that are not isotonic, which is available in the market. So whenever you are
Absolutely.
replenishing with your electrolytes, especially when you are having powder, not as a sachet, in a powder
Right.
in a can, you should know how
Uh-huh.
much of I mean, your electrolyte powder has to be mixed with the adequate amount of water. So it should be isotonic. If you are going to be hypertonic or hypotonic, I think headache
Okay.
will occur. So be
Okay.
careful of what you do, and let's see how it helps you.
Yes. So do give us the feedback. I'm not getting the answer. I mean, I'm sorry, I'm not getting the name over there. But the person who has asked, yes, Ram. So, Ram, I do hope that these steps that the doctor has mentioned, you can go back and try a few of these things, try to consume sugar. It's just a basis, like after the run, you probably have to do a little bit of trial and error and see what works for you. And do get back to us about the salt and sugar issues that sir mentioned about the pressure, about the your blood pressure and the stress and everything. Manage that at those levels and do come back to us and tell us, has it affected you positively in some way. I hope the doctor advice is going to work for you, and in fact, I'm pretty sure of that, because he's an expert in his field and he's a runner by himself. He understands all about these things. So
And ma'am,
and the
one more to
other,
add is that whether they had a good sleep prior to that run. So that
that
is
is such
also
an
important.
important
Yeah.
factor, right? Right. So, yes. So the other question from probably I'm not getting the name, is a Facebook user. Okay, someone who's joined us live on Facebook, and he is mentioning he or she a lipoprotein test. Is this becoming an important test to keep watch on?
I think you stole my thought. I wanted to add on as one of the tests. I think very good question. Whoever, I think probably he or she's a doctor. Um,
Yes, I
I
hope.
think the one test that we do in our annual checkup is the lipid profile, where we look at the different kinds of cholesterol, the good cholesterol, the bad cholesterol. There is also another cholesterol which is called the ugly cholesterol, which doesn't
Okay.
come under the package. That is called
Okay.
lipoprotein small a. That is not upper lipoprotein. This is called lipoprotein small a. Small a with inverted brackets. This is an ugly cholesterol. Reason is
Right.
that if this is linked with your genetics, this is the family. This will tell you your risk. If your lipoprotein small a is more than 30, it is abnormal. If it is more than 100, we have to do some drastic measures to make sure you are on statins. Because
Okay.
even though lipoprotein small a cannot be reduced at all,
Mm-hmm.
still we need to keep our LDL, that is called the low density cholesterol, below 70. Whether you're
Okay.
having cardiac problem or non-cardiac problem, whether you're diabetic or non-diabetic. So
Okay.
please know these numbers. Lipoprotein small a below 30, you need not worry. This is once in a lifetime test. You don't have to do it annually. Just
Okay.
one checkup is more than enough. This does not come under your conventional annual checkup. So you need to ask the lab that kindly do lipoprotein small a. So lipoprotein small a will. I'm doing right now. I'm doing a. Am I one of my? I'm a guide for one of my PhD scholar. There, she
Right.
is doing this lipoprotein small a. Another one
Okay.
and a half years, I think we will be published the result on diabetic people. So
Right.
I have another postgraduate also doing. So that's one of my uh, topic that close to my heart. So we do have. There are certain medicines in the pipeline which are going to reduce lipoprotein small a, which is not
Right.
available in India as of now. It's still in research.
Mm-hmm.
So probably
Okay.
in next 5 years or 8 years, that medicines will be available in the market which can be used. So
Right.
for this we require some kind of gene sequencing to see whether it's in the family. So I'm not going to complicate issue. Just do this extra test, and this lipoprotein small a has to be done by every person
Okay.
once in a
Yes.
lifetime, and keep it in as a record, so that like your Aadhaar number, keep this your number rest of your time. And if your
Mhm.
numbers are below 30, you need not worry at all. Just take
Okay.
the medications if required as per your doctor's advice. But if it is going beyond 30, you have to be careful about your cholesterol. But if it is going beyond 100, make sure that your LDL cholesterol stays between 55 and 70. Not so you have to suppress the cholesterol, the LDL cholesterol between 55 and 70.
Okay. So we have LDL and HDL,
Correct.
the different
And
types of
triglycerides. So
cholesterol,
I'm just focusing on one number
triglycerides.
so that I don't want to complicate things. So just
Right.
focus on your
And the
LDL.
lipoprotein small a is an important test.
Lipoprotein
So
small a.
that question actually came from Amal Vartak. So Amal, thank you for joining us, and I hope that answers your query. And of course, what I'm going to ask you next about. So we've been talking generally, about running and all, but my specific question right now to you is about women runners. And most of us. And we've had a chat about this before as well. Menopause is something that affects women at some stage or the other. And how does it, like, does running help to alleviate some of the symptoms, or are there any specific tips that you can give for menopausal runners, to use running as a way to get out of those bad days, and
Yeah.
the hormones, the effects that it may have on a vulnerable woman?
Yeah. So when you compare between man and a woman has every decade is a different phase in her life, starting
Right.
from her puberty till her childbearing phase. Then you have a menopausal phase and a post-menopausal phase. So she goes through different seasons. That's why you can see that emotions also vary based
Absolutely.
upon the hormones and all. And
Right.
we need to factor in all these things, and they need to factor in. We need to support them, being their spouse or their father. That we need to make sure that these hormones all have, they play well in tandem. So when you
Mm-hmm.
have this hormone called estrogen, which slowly start depleting during your perimenopausal and
Right.
stops functioning at your menopause. So we need
Right.
to make sure that that is the vulnerable phase, because you become as equivalent to a man to get a cardiac problem, because estrogen
I see.
helps you, protects your heart. In postmenopausal or perimenopausal, the heart becomes vulnerable because estrogen drops. And what
Okay.
happens is that we all, being it a man or a woman, after the age of 40, we start losing our muscle mass. And we call
Correct.
this as sarcopenia. So
Absolutely. I've
once
heard
a
about it.
woman attains her menopause, the sarcopenia accelerates. She loses her muscle mass quickly, much more
Okay.
faster, and is
Okay.
replaced by fat.
Okay.
So they don't change that. They may have a weight gain. They will not have a weight loss. But this weight gain is probably because of the fat. And that's where, we can see that they are much prone for falling,
Uh-huh.
or they twist their ankle while running, and all these things happen in mostly in postmenopausal phase. Again
Okay.
comes your, so sarcopenia, muscle has to be strengthened. So running probably is not enough. All of us need to do some isometric exercise, strength training, at
Strength
least
training.
3 times a week from the age of 40. So we need to
Okay.
prepare our body for the menopause. Menopause is inevitable. Like how we say death is inevitable for a woman, menopause is inevitable. So they need to prepare their body at least a decade ahead. So come at their late 30s, and every runner should do an strength training. And lady in their 40s should definitely do 3 times a week strength
Right.
training, hit the gym or can have an home gym.
Right.
You can lift 1 kilo of atta in your, and you can do everything at home. You don't have to go to a gym because of the, if there are issues of timing. But if you are
Mm-hmm.
able to go to gym, go to a physical trainer, and
Right.
they will be the best person to tell you how much of weight to be lifted. But definitely isometric exercise and strength training, functional training, yoga, all this can be a part to train your, adapt, help your body adapt for your menopause. Because there are
Right.
also some climatic symptoms, like suddenly hot flushes comes in. You may be in
Yes.
an air conditioned room, you'll be sweating profusely. So these
Right.
are all part of that hormone and imbalance, which running as well as this isometric exercise helps you a lot. There could be sleep disturbance. There will be problem in the emotions. Suddenly we become very labile in our emotions. We cannot control our anger to the. So these are all
Yes.
passing clouds. So if we
Right.
are able to take things in perspective and start doing it, if not done, like till now you have not done it, please tomorrow onwards think about it. And those who are young in their early 40s, please start taking care of these facts. Never lose your muscle, because once you lose your muscle, the body becomes frail. And
Right.
this is the time when diabetes, every all the heart issues and lifestyle disease starts coming out. Till then they are all
Okay.
hidden because we have enough muscle. They are our shock absorbers. So when the shock absorber system goes down,
Yes.
we feel the thud in our every time we move around, and that will
Right.
lead down to waddling kind of gait, and we fall. So much other disturbance comes in.
Right. So it's like a series of things that can go wrong because,
Yeah,
of your imbalances of hormones, which is a natural phase for every woman. And I
correct.
think that's great advice, and especially because I'm now reassured that I'm on the right track. I've been gymming, and I feel quite happy about it now. So it's somewhere in the long run, it's going to help me. And of course, again, as Sir has mentioned, go to somebody who has a proper track record in coaching, where be it
Mhm.
running or gymming or everything. So caution is the word. It's only the person himself who can guide his own training in some way. So you have to participate in your own training and not just leave everything in the hands of the coach and the gym trainer. So you should know to when to recede from the activity if you don't feel too well during it.
Manisha,
Am
one
I
more
right?
thing, that you look at your calcium and vitamin D. That's also very
Right, right,
important for your bone health. So
right.
start replacing your calcium and vitamin D as soon as you're in a perimenopausal, means 2 years. Because we take a probably a ballpark number would be 45 for a menopause. But for runner, I think this menopause date are even post 50 as well. So if you have been a good runner for the last 7 8 years, you can delay your menopause. Means your estrogen
Okay.
stays in your system for a much longer time.
I
But make
see.
sure that you take your calcium and vitamin D as a kind of replenishment much ahead of it, so that even once you hit your menopause, still your bone is strong.
Okay, that's really great advice, and I'm sure it's helpful to all of us because somewhere or the other we are going to face that phase in our life, and we'll be much better prepared then,
Yeah.
rather than floundering for advice at that point of time. So, sir, I am. We have almost reached the end of the session, and I'm just going to say that if there's anything else other than this which you would like to add, because you've added a great store of knowledge today, being a runner and a doctor, a researcher, a teacher. How many roles have you actually played? And you've done them all so well. You're also heading a department of medicine. In all of these roles that you play, do you think that running has added a lot of value to you as a person and as a professional?
True, running is a great stress buster. Yeah. So once you go for a morning run, you feel fresh. Your thought process are all in the right place, and we declutter our mind. So what had been there yesterday in our thoughts, they are all organized much perfect way, and I am able to do. I'll tell you one thing that I'm telling in man has been never a multitasker. A woman is always
Mhm.
a multitasker
Right.
by default. Running
Yes.
has made a man to also improve in that domain as well. He starts
Hmm.
doing multitasker, may not as efficient as a woman, but
Right.
definitely it has helped me like that. So I'm able to find some balance in my professional life as well as my free time. And Fridays are always going to be, we are hitting the bed early. So thank God it's Friday is no more in our for a runner. For us,
Right.
long runs for some people it's on a Saturday. So
Yes.
our we don't have vices. So we don't go to late night shows or partying and all. We go to bed early. We preferably because we know tomorrow is going to be a long run, so we try to get a good sleep away
Yes.
from mobile. Only thing that we have to make sure is that don't fall into peer pressure. So just don't go for the numbers. These
Yes.
timings are incidental. So let's all feel happy. Let's have joy of running is what we require, but
Absolutely,
let's
sir.
not outrun that process. So we should enjoy what we do, be happy, and make sure that we become an inspirational tool for an uh, probably for your neighbor or your friend or of your own children. If we ask
Yes.
our kids to go for running, they will not. But if
They
they
won't.
see us going every day up down, when they become mature enough to understand, they automatically will go to gym or they do their treadmill or they even run along with us.
Mm-hmm.
That's the dividend that we get it probably later, but let's start
Right,
doing it.
right. So, I thank you for your time, and I hope this all these issues that we've spoken about today have addressed a lot of the queries, that runners generally have about health issues, and a lot of us were scared because of these untoward incidents that have been happening over a period of time. So, in conclusion, I would just like to say that we all have to take charge of our own health in that sense, and not only that, we should enjoy running, and not the rewards that or the appreciation as such, as you mentioned, peer pressure. Not falling victim to that will probably stand us all in good stead, besides having the backing of a good doctor and taking care of our families as well, and not forgetting all of these factors that make us a complete human being, and not just focusing on running completely, but at the same time being attached to running in that sense in a holistic manner, right? So, sir, we've had a very fruitful chat with you, and you've been in the US and you've been so supportive, and I really thank you from the bottom of my heart. I thank Mumbai Road Runners for giving me this opportunity to have this interaction with you. So I'm just going to sign off now, unless we have no other queries. I'm asking permission from the audience, and I hope you all will go back and like it on YouTube and Facebook, and give us the likes and the views, and talk about these sessions so that we can have more such experts joining us later. So thank you once again, Dr. Kumar Janardhan. If you're ever in Mumbai, please do give us a call. We would love to meet up with you, and take this session further. So would like to know the person behind the doctor as well. And thank you for your time today.
Thank you so much. I think it's been an honor and privilege, as I said. And if I'm in Mumbai, I always look into Vijay Nair, my run buddy over there, Reggie Matthew, and Satish Gujaran. I think they are my run buddies. Definitely, we all will find a place and we can all run together. Thank you so much.
Thank you. I think we will close the session now, and hope to see you again soon. So, all our viewers, if you all have any more queries, we can still reach out to the doctor. Do let us know, and also give us your feedback. What else you would like to see in the session, what you liked about it, or what you didn't. So, signing off. Thank you on behalf of Mumbai Road Runners, and have a good day.